Welcome to the Nonviolent Crisis Intervention Overview. The integrated experience describes how behaviors in our approach or response to an individual can either escalate or de-escalate the situation. There are 4 behavior levels and staff approaches that are described in this presentation. Level 1, anxiety and supportive. Level 2, defensive and directive. Level 3, an acting out person and nonviolent physical intervention. Level 4, tension reduction and therapeutic rapport. Appropriate staff response to student behaviors will help the students stay at a lower level of behavior or lower the behavior to a safe and manageable level. In order to do this, we will discuss some key points to remember with each level of staff response. Level 1. When there is a noticeable change in the typical behavior of a student, it may indicate that there is something wrong. As staff, it's important that we take the time to give support to that individual. Make sure to pay attention to their personal space, as well as be aware of the nonverbal messages being displayed by both you and the individual. Using a calm, quiet voice, offer reassurance and ask if the student would like additional support. Level 2. Sometimes student behaviors become defensive and begin to escalate. Some behaviors may include a refusal to a staff request, yelling, use of profanity, trying to initiate a power struggle, or some type of intimidation. As staff, we respond by being directive with our request and avoid a power struggle. Give choices to redirect and seek assistance if necessary. Do not physically engage with a student. Level 3. When students physically act out, we are concerned for both the student's safety as well as our own personal safety. At this level, the student has lost all rationality and has become a danger to themselves or others. Behaviors may include hitting, throwing objects at a person, and kicking. Staff should respond by blocking or moving and calling for assistance. Do not physically intervene unless you have been trained through the district in nonviolent physical intervention. Once the crisis is over, we work to rebuild the relationship again and establish rapport. It's important that the student be a part of this process to have ownership of their behavior as well as developing plans to prevent future behaviors from happening. It is important to note that behaviors do not happen in an isolated vacuum in a specific order. Staff members should be familiar with the different levels of behavior and be able to respond in an appropriate manner, being aware of all the outside factors that may play a role in the situation. This concludes the Nonviolent Crisis Intervention Overview. If you should have any questions, please contact one of the district certified instructors. Have a wonderful and safe school year.